Hello everyone and welcome back to another Medicine of the Week. Today we are diving into Abemaciclib, a targeted therapy that plays a vital role in treating certain types of breast cancer. Abemaciclib is a selective inhibitor of cyclin-dependent kinase 4 and 6, also known as CDK4/6. These kinases are crucial in regulating the cell cycle, especially the transition from the G1 phase to the S phase. By inhibiting these kinases, Abemaciclib halts the progression of cancer cells through the cell cycle, leading to growth arrest and reduced proliferation of hormone receptor-positive, HER2-negative breast cancer cells. Abemaciclib is primarily indicated for hormone receptor-positive, HER2-negative, advanced or metastatic breast cancer. It's often used in combination with endocrine therapy, such as aromatase inhibitors or fulvestrant. In some cases, it's also approved as monotherapy for patients with disease progression after endocrine therapy and chemotherapy. Moreover, Abemaciclib is also approved with endocrine therapy as adjuvant treatment for patients with hormone receptor-positive, HER2-negative, node-positive, early breast cancer at high risk of recurrence. Abemaciclib is taken orally with bioavailability of 46%. Interestingly, high-fat and high-calorie meals increase the area under the curve of parent drug and its active metabolites. Abemaciclib has significant binding to plasma proteins such as serum albumin and alpha-1 acid glycoprotein. It's extensively metabolized in the liver, primarily by the enzyme cytochrome 3A4, into active metabolites. It has a half-life of around 80 to 25 hours, allowing for twice-daily dosing. Steady-state concentrations are typically achieved within 5 days of regular dosing. Like many targeted therapies, Abemaciclib is associated with specific side effects. The most common is diarrhea, which can be severe and often requires dose adjustment. Other side effects include fatigue, nausea, neutropenia, and hepatotoxicity, which necessitates regular liver function monitoring. Rare but significant risks include venous thromboembolism, especially in patients with predisposing conditions. Since Abemaciclib is metabolized by cytochrome 3A4, interaction with drugs that inhibit or induce this enzyme are important. Strong inhibitors can increase Abemaciclib levels, raising the risk of toxicity. Conversely, enzyme inducers can reduce its effectiveness. It's also worth noting that Abemaciclib itself can affect substrates of P-glycoprotein, potentially altering the pharmacokinetics of co-administered drugs. However, clinical relevance is questionable. Let's wrap up. Abemaciclib is an oral CDK4/6 inhibitor used primarily for hormone receptor-positive, HER2-negative, advanced or metastatic breast cancer, often in combination with endocrine therapy. It blocks cancer cell cycle progression and is dosed twice daily. Common side effects include diarrhea, neutropenia, and hepatotoxicity, with drug interactions mainly involving cytochrome 3A4, inhibitors or inducers. Thank you for joining me for this overview on Abemaciclib.